doctors would be the PHCS network.
Okay, do you have my email address there?
Yeah, I have it here. I actually did see.
Can you go ahead and, while we're on the phone, just email me the, like, I don't know if you have a brochure or something, you can, like the plan summary or whatever it is. If you could email that to me and then we can just look at it. And so far it sounds good, man. I just want to see it. And
yeah, that's the next step. So just quickly, just so I can understand, or just so you can understand, this policy I can't just send to you. They do have what's called it's a medically underwritten policy. So yes, instead of you going and having it physical and wait for the underwriting process, it's better to go do it electronically. You and I would fill an application out together, and I'd get you over to the carrier so they can send you all the terms and the conditions of the policy while they're on the phone with you. And once you sign off and agree to the terms and conditions, that's when the ability the first month and your coverage could start tomorrow. But myself or any agent, I can't send anything to you prior to that, prior to going to the application process.
okay. I can keep this rant short. I'm just looking at some old clips, some old videos. I was doing a little series on YouTube called Lyin Ass Agents, and Lyin Ass Agents is still, to this day, one of the biggest problems in our industry. And so if you're ever talking to an agent, you're looking for health insurance, you're talking to an agent, you say, I'd like to see the information, which 99% of the time, that's what people want to see. They want to see the details, right? And they tell you, no, that's the next step, but, I got to get your, your information. We fill out an application. I need your social security numbers. I need your, your bank routing and account number. And then you get the information. Then we send you the policy details. Run. Do not do business with that agent because that's all they are. They are a sales agent. They will do nothing for you beyond enrolling you in that policy. Don't think they're going to be there to support you and service you when you need that later on, which our healthcare system has become so friggin' messy that that's a need, right? And so, believe me, there's tons and tons and tons of agents out there that will provide the details of the policy to you, that will go over it with you line by line, that will answer all your questions in great detail, that will be there for you when you need to use that policy. All right. I happen to be one of them. Okay. I'm an insurance agent. I do consulting. I do insurance training. I work with a healthcare advocacy group that I founded in 2020. I've got my phone numbers, my websites, my handles on the screen here. Get in touch with me if you need some support finding the right health insurance plan. But whatever you do not do business with anybody that is going to hit you with a few bullet points of a policy and then demand your personal information and your billing information prior to you getting the details of those policy. Okay, rant over.